presence, and I welcome you all. Good morning, and thank you for the invitation. I'll be talking on behalf of Dr. Mina Özkan, as she's got some medical problems. In fact, our basic interest in psychiatry is liaison psychiatry, which is one of the subjects of this Congress. Liaison psychiatry means not the psychiatry of mental illnesses, but the psychiatry of the medical patients. So I've been the past president of the Constitution Liaison Psychiatry and Psychosomatic Medicine, and Dr. Mina Özkan is the acting president of the department at the Istanbul Faculty of Medicine. So before going into the slides, I'd like to give you some information of my concepts about the general framework of psycho-oncology, psychodermatology. As for the psychiatric aspects of the dermatologic disorders, the skin and the nervous system originate from the same embryological tissue, and disruptions in one of those systems can significantly affect the other. The relationship between skin lesions and psychological states has served as one concrete example in the development of psychosomatic medicine. The skin is often regarded as a mirror and indicator of emotional states. Everyday emotional changes such as fear, joy, anger, embarrassment can induce physiological changes and responses in the skin. The skin plays a vital role in regulating body temperature and fluid balance, contributing to adaptation and homeostasis. It is essential for responding, the skin is essential for responding to both internal and environmental changes. The skin is rich in receptors in pain, touch, and temperature sensations. In this context, the skin is responsible for the homeostasis of the body ego. There is an interrelationship in between body ego and psychological ego. The skin functions as one of the most fundamental means of communication and interaction in human personality and interpersonal relationships. As for the topic of my speech, I'd like to say that there is a direct interaction and interrelationship between and among the state, the skin, the brain, and the mind. Cell affects the mind affects the cell. This is the main concept of psychosomatic medicine and liaison psychiatry. The mechanism by which this happens is the area of psychoneuroimmunology. That means how the mind affects the brain and how the brain affects the body. The basic pathways for how the mind and the brain affects the body are these. One is the autonomic system, the second is limbic hypothalamic hypophysis arterial axis, and the third one is immune system. Stress does affect the initiation, precipitation, provocation, prognosis, and response to treatment of all cancers in this regard. On the other hand, various psychiatric and emotional reactions occur in response to cancer, which also affect the prognosis of cancer. This is our motto. This means treating cancer does not mean treating the patient with cancer. That's why we say the whole patient. And the fight against cancer is a joint struggle of the body, not just the body, the mind and the brain. So the skin functions as both as an immune organ and metabolic active interface between the individual and the external world. You can read the slides. Short-term stress may enhance immune functions, but it may also trigger and worsen immune-mediated dermatological conditions. Just basic sleep disturbances and circadian rhythm disruptions elevate stress levels, leading to pro-inflammatory state that can intensify various stress and skin diseases. You know much more about these than I do. This is the general scope of skin cancers and what its risk factors are. As you all know, the most common types are basal cell carcinoma, and melanoma is the less prevalent, but it causes metastasis and the most deadly form of skin cancer. I'd like to try to explain how and in which mechanisms psychological stress can affect skin cancer. So what is stress? It differs from people to people, from side to side here, but stress is defined as the emotional, cognitive, behavioral, psychological, and physiological reactions when a person confronts a situation in which the demands exceed their coping resources. A stimulus can be stressed in two ways. One is the perception of the stress. The second is the management of the stress. So in psychotherapy, we focus on these two separate aspects of what the stress is and how to manage with it. Cancer is an earthquake. Cancer is a narcissistic injury. Cancer is an earthquake, not just on the body, on psychology, on every aspect of the person's life and psychology. This is how cancer is perceived basically in all cultures, regardless of geography, culture, and religion. So it implies pain, it provokes the ideas of death and what the meaning of life could be, should be. It causes decrease in physical capacity, and it challenges the person in all aspects. And the main fear in all of the cancer patients in their minds is the recurrence of cancer. Okay, this is my figure. Okay, so in this I am trying to depict how stress affects the body. First is the cognition that names the stress. The stress is first in the mind, in the cortex. If it can be resolved in the cortex, it's not going to be perceived as stress anymore. If it's not resolved in the cortex or in the mind, then central nervous system is activated. First, the somatic nervous system is activated. If the stress effect is still keep going on, autonomic nervous system is activated, noradrenaline. And if that is not sufficient, then limbic hypothalamic hypophyseal adrenal axis is provoked, which causes the increase in cortisol in the body. If all these three mechanisms fail, then the stress deepens and affects the immune system. So in principle, there are two main systems. One is sympathetic adrenal medullary axis. This is the system that works in acute stress. The second is basically hypothalamic pituitary adrenal axis. Obviously, every organism in this world, when confronted with stress, reacts in a way of fight or flight. But the person with cancer cannot fight and cannot flight. That's when the emotional stress becomes. Stress in these people is mostly not concerned with environmental or social environment. The stress of the cancer patients is mostly affective, emotional, cognitive. Yeah? They work through all of their lives anyway. So psychological stress triggers the release of cortisol from adrenal cortex, and stress induces release of catecholamines, epinephrine and norepinephrine, and all these make the person prone to cancer. I'm not saying cancer is a psychological disorder. I'm saying psychological states and the emotional status of the patient has got a role in precipitating or in initiating cancer. Both catecholamines bind to adrenergic receptors, resulting in reduced skin flow, altered immune and inflammatory processes. This is a resume of what I'm trying to say. And as for the relationship between stress and the brain, when a person is confronted with a stressful situation, these three regions of the brain are affected. Amygdala. In fact, this is a situation not just with human, but all species, fight or flight. Amygdala is the area that detects threat. Hippocampus is responsible for memory. For example, if the person has a memory of childhood traumas, stress would provoke them. And then prefrontal cortex is the area of the brain that names stress. Okay, molecular and cellular effects. Glucocorticoid receptor signaling changes, neuroinflammation and oxidative stress, and epigenetic term changes.
So we have 2 minutes left.
Okay, stress in the immune system. Acute stress partly enhances immune response temporarily. It's the chronic stress that is detrimental to the patient. This interprets the association between stress and tumor biology. And as for the neuroendocrine regulation of tumor environment, so this summarizes how cortisol affects T cells and T cells, and how catecholamines play a role in tumor growth and metastasis. And this interprets how stress affects natural killer, and how it promotes Treg cells, which is tumor promoting. And this is the relationship between tumor vascularization and angiogenesis. Experimental evidence and the animal models say chronic stress, it has got a role in tumor growth and metastasis. This is a study conducted by Mine Özkan and her associates. It says with breast cancer patients, the most powerful independent risk factor was identified as a significant stress expressed in the last 5 years. If you search into the psychological, personal, and family history of these patients, you will most probably face with a stressful life situation in the last 2 to 5 years. And this is one that I like very much. It interprets how stress, what we mean stress, psychological factors affect the body, the immune system, and the mechanisms by it. So endocrine activation, circadian rhythms, and immune defenses. This is one of the basic concepts of psychoneuroimmunology. And beta blocker plays a role in reducing the progression of cancer. It's interesting. And what we shall look into the psychological status of the patient, search into depression, anxiety, and chronic stress, socialization, history of trauma or adverse life experiences, and maladaptive coping mechanism. Depression is not a disease of the mind and the psychology. Depression is a disease of the whole body. It's like diabetes, it's like hypertension. So depression does not affect just the brain, it affects all of the person's body immune system. Depression, for example, increases cortisol secretion in the body. And skin cancer, as I told you, fear of recurrence is the main issue in the minds of these people. So search into screening for depression, anxiety. Okay. As for the psychological management of these patients, CBT is the most widely and working psychotherapy model. Besides beta blockers, antidepressants can be used widely in these people. And this is my last comment. If the mind gives up, the body gives up more quickly. Thank you very much.